Let me take this opportunity to call upon the next plenary session, that is the transitioning to patient-centered care to improve quality. Dr. Alan Cheung, please come up on the stage to take over task.
Good morning, everybody. So following this very dynamic, versatile, and enjoyable debate, now we can proceed to the next session of the plenary. The theme of the session is transitioning to patient-centered care to improve quality. Most hospitals around the world will include patient-centered care, quality services, patient safety as their top priorities. And they may include them into their vision, their mission, or business strategies. However, performance of hospitals in these areas actually varies. So it's time for us to revisit these issues and to see if there's a way that we can relook into these issues systematically and to ensure performance. So here comes our next speaker. Please welcome Dr. Stephen McAdam to the stage. Dr. Stephen McAdam is the Global Technical Director for Healthcare at the DNV Healthcare. DNV is an independent foundation with objectives to safeguard life, property, and also environment, and is committed to support healthcare organizations to improve patient safety. So Stephen, the stage is yours.
Good morning. It's a pleasure to be here, and I'd like to thank the organisers for giving me the opportunity today to talk about a subject which intuitively seems very simple to grasp, but in practice, implementing it seems extremely difficult. And I'd like to, I could put my slides up. I'd like to just explain a little bit about the background behind my talk. DNV, I'll explain a little bit about the organisation in the next slide, but DNV has been working with an innovation think tank based in Copenhagen in Denmark called Monday Morning for a number of years, looking at developing narratives and best practices around developing sustainable communities. And about 18 months ago, we met with Monday Morning together with our research team that's based in Norway that focuses on patient safety. And we spent some time looking with them to see what are the drivers in healthcare that could contribute to move healthcare towards a more sustainable development. And the one driver that came up and that there was agreement on there was patient-centered care. So the last year we've been looking at that. We've done a literature review, and we've interviewed in the last few months around 50 experts ranging from patients through to ministers of health for different countries, and interviewed them to understand what they understand about patient-centered care and what's the status of patient-centered care. And I had hoped that that report would be ready to show you today. Unfortunately, we've just managed to finish the data collection, but a lot of the slides that I'll show now are based on the learnings, the initial learnings that we've got from analysing that data. The report should be ready in November. So DNV is it's an independent foundation established in 1864, based in Norway. We now have, well, when I sent these slides in, we had 10,000 employees. We now have 17,000, so we've doubled almost in size this week because of what's it called, fusion. But we're an independent foundation, and that means that we can focus a lot of our resources on improving and helping our customers doing what our objectives are, which is to safeguard life, property, and the environment. As I mentioned, we have a research group that focuses on patient safety, and we're very much committed to helping the communities that we work in. Our main competence in DNV is helping customers identify risks, manage their risks, and we do that in a range of industries, originally in the maritime industry, but increasingly in industries like healthcare. And we, at the moment, provide services in a number of countries in healthcare, including international accreditation and the service that my colleague talked about yesterday, managing infection risk. But the first question we asked the experts was, what do they understand by person-centered or patient-centered care? And I think it's no surprise that we couldn't find a consensus on that. There were a lot of different types of responses, but what we could find is that there was many of the responses covered different elements using different words, and we've tried to identify 4 elements that are interrelated and connected, which pretty well captures most of the responses from these experts. The first one we call holism, and that's about again, obviously putting the patient in the center, but making sure that the patient is treated with dignity and respect, and that the entire needs of the patient is taken into account when you're designing and delivering care. So not just the physical needs based on the condition or the diagnosis, but psychosocial, spiritual, any other needs or things that are important to the patient. The second area is that most of the definitions covered the idea that delivery of care is a partnership rather than just a service that is provided to the patient. It's a partnership that the patient and the patient's family needs to be involved in. The third area we call coherence, which is very much about making sure that all the partners involved in care delivery are informed about the issues, and that their care is provided in an integrated or coordinated way. Not an easy task, as we heard, when healthcare is so complex. And the final area that was mentioned in almost all the responses was it was about engaging patients for them to understand that they're the experts in how they experience their care, and trying to free the resources that the patients have to contribute to the care that they need to have. Now, I don't have time to go through all this. I'm not sure if you can see it clearly, but patient-centered care is not new. I mean, some could argue that there's always been elements of patient-centered care from the very beginning. It's really a continuum from very patient-centered to poorly patient-centered. But really the movement that could be recognized today started in the 1950s with work like the work of Michael Ballant, who was a psychoanalyst who worked in primary healthcare in Manchester, actually, who was very interested in the patient-doctor relationship. But it really started to pick up in the late 70s and the early 80s with the establishment of Planetree and then Picker Institute. And since then, there's been more and more things developing. Particularly important was the recognition by the Institute of Medicine in the US that patient-centered care was one of 6 elements that really needed to be improved to transform medicine in the US. In 2006, the International Alliance of Patient Organizations, they also released a declaration for patient-centered care. And in 2010, the WHO widened the scope of patient-centered care to emphasize that this was about patient-centered care for all in the global community, not just for those in the developed countries, but also for those in the developing countries. And I think from 2006 onwards, we could have put a lot of points on this. So there's really a momentum in terms of what's happening around patient-centered care, but the question is, does it work? And so what I've done here is just plot the hits in PubMed. If you search on patient-centered care, you get the same kind of pattern if you search on things like integrated care, family-centered care. And you can see that there's very few publications, just a scattering of publications till mid-1990s. And from 1994, 95 onwards, there's an explosion of publications. So now there's a real body of literature and some evidence looking at whether patient-centered care approaches have any benefits. And I think what surprised us when we looked at that was there's clearly an obvious interest in patients pursuing and promoting patient-centered care, but increasingly there is more evidence that there are also benefits to providers, to payers and policymakers, so all the stakeholders involved in delivering care. There was a recent report last year that came from the UK, from the UK Innovation Agency, Nesta study, which looked at 51 studies and real-life business cases from 6 sites in the UK that have been implementing patient-centered care. And again, they found that there was clear benefits to the persons, that were involved, but there were also very real benefits to the payers and at the policy level. They estimated that for every patient they could save 7% in costs for treatment, very often related to early or shorter admissions and less readmissions. But they also noted that to get that 7% reduction, which translates to about £4.4 billion savings every year if they could implement patient-centred care across the UK, they also recognised that it requires an investment to educate clinicians, to educate patients, and to move towards this patient-centred care. So there is evidence now, increasing evidence, I won't go through it all, but that you can implement patient-centred care approaches and that you can save money, you can improve clinical outcomes, you can have happier patients. So you would expect that it would just take off and that we'd have patient-centred care-based facilities all around the world. So where are we? Well, that's clearly not the case. We can find lots of good examples, and we've looked at 10 examples from around the world, from developing economies through to the UK and the US. But many of these examples are quite limited in scope. They're often dependent on champions of patient-centred care, and one can question the sustainability of these kinds of approaches. We still argue, and I'm always willing to be proved wrong, but we still argue that it's very difficult to find hospitals or healthcare organisations that truly have processes where the patient is embedded in the centre, that are delivering patient-centred care reliably and consistently, so tailored care to every patient. Why is that? Well, I think you probably know a lot of the answers. First of all, we found that experts were saying there's still a lot of lack of knowledge. How do we start? And specifically, lack of knowledge around structured knowledge, which allows and helps hospitals and other healthcare providers to start implementing in a staged approach. And there are some very good documents out there, but a lot of people don't know about them. I mean, in 2008, I think Planetree and the Picker Institute released an implementation and how-to guide, which has a lot of good information. But when you talk to many hospitals, they say, we don't know how to start. There's always, when you want to try and change things in a major way, there's an organisational resistance. So hospitals are organised, as you all know, often in silos, in departments, in professional groups, and trying to break down those barriers, there will always be a resistance to that. There's also a problem with mindset and culture. Many times, there was a recent report that came from the Health Foundation looking at shared decision making, and every single case that they looked at, the initial resistance was from the healthcare workers saying, we already do this. And the findings at the end of the intervention was, oh, we didn't realise we weren't doing it, and this really helps. So this is one of the issues around mindsets and culture. There's also an issue around engaging and activating patients. The training in many countries doesn't address some of the skills and the practices that healthcare professionals need to practice patient-centred care. And of course, there's perverse incentives. It does require an investment, and sometimes the group that will reap the reward of the investment aren't the same people that are having to invest in the front end of introducing patient-centred care. And of course, there's limited resources, which we all know about, but if you need to invest, if you need to change, that doesn't come without some investment. So where to start? Well, there's a whole range of things that you can do, and as I mentioned, the how-to guide that the Picker Institute and Planetree issued is a very good starting point. Of course, you need to start to engage patients. You also need to engage other stakeholders. A lot of the barriers that I mentioned aren't those that are controlled by your organisation alone, so you need to start building alliances. You need to develop visions for your organisation that include patient-centred care. You need to have a top-down approach where you have your senior management committed to improving and implementing a patient-centred care approach. You also need to have a bottom-up approach, so you need to identify local champions that can start to implement this at a local level and demonstrate that there are benefits to the healthcare workers, to the patients and to the hospital. You may want to do an assessment to see where are you. You might find that there are certain departments, certain areas of the hospital doing very well already, and you can learn from them. There may be other areas where you thought you were doing well, but you're not. And you probably want to have some initiatives where you can identify quick wins. But the most important thing, and it was discussed earlier, is you need to work systematically. Healthcare is complex, and just doing things willy-nilly will get you not very far for a long time. And actually, I just wanted to ask, because I'm interested based on the results, I want to have a quick straw poll. How many people here represent healthcare organisations that are working with healthcare organisation providers? So who works in hospitals or healthcare providers? Put your hands up. There's not many. You're okay? Keep your hands up, everyone who works for providers. How many of you have hospitals or healthcare providers that are committed or have a vision or ambition to provide patient-centred care? Okay, great. How many of you, keep your hands up, those ones who kept your hand up. How many of you here have developed mechanisms, apart from patient satisfaction surveys and apart from complaints, where patient feedback or local community feedback can be put into your management system? Well, very good. Well, I want to learn from you, because that's one of the key areas where we found people were struggling. And I haven't got time, but I'll just say that it's clear that quality management systems we can learn from other industries. Other industries, I believe, are simpler, but they're learning principles that we can use and we can apply to other industries. We need to make sure that we're putting patient-centred care objectives, defining quality with patient-centre in there. We need to then set objectives and use the plan, do, check, act mechanism in it. And finally, I just say that we think there's an opportunity to use risk management to provide, to gather input from patients and their families. And I'll finish there. I'm sorry I ran out of time. If you're interested in knowing more, if you have some ideas about how this can be improved, please get in touch, and I can provide copies of the report in November if you're interested.
Thank you, Stephen. So Dr. Stephen Madden has given us a very enlightening talk on patient-centered care. We professionals, clinical professionals and hospital managers are all committed on patient-centered care. Okay? And Stephen has given us a framework on what is patient-centered care, what are the barriers, how to start with patient-centered care so that we can rethink on the issues and probably have a self-assessment on our organization on how we are doing. So I would like to invite questions from the floor. So over on my right side, yes please.
Thank you. It's Margaret Banks. I'm from the Australian Commission on Safety and Quality in Healthcare. I'm responsible for the development and the reforms of accreditation across Australia in the last few years. Included in the 10 national safety and quality standards, which are now mandatory for all hospitals and day procedure services, is Standard 2, which is partnering with consumers. We require that organisations work towards the development of patient-centred care. We've developed a suite of resources that have been used and are available to hospitals, and increasingly we hear our private hospitals say we should have been doing this for a really long time because it makes really good business sense. So we've got the whole of Australia working on this particular thorny problem at the moment. I'm sorry I don't have a question, really a statement to say that I'll talk a little bit more about that later this afternoon.
Just a response to your comment, I think this is happening in a number of countries. I mean, the UK, as you may know, is undergoing the biggest reform now since its establishment, and that's based on 3 principles. And the first one is that healthcare should be provided in a patient-centred manner. The 2 others are that they're going to move more towards outcomes rather than measuring clinical processes, and that they're going to be empowering GPs or general practitioners. It's the same in the US. The US released a strategy on quality improvement in 2011, and there they have 3 goals, joint goals, and the first is implementing patient-centered care. But despite that, when we talk to hospitals in a number of countries, including these countries, they're still struggling to understand what the concept of patient-centered care is and how to scale it up more than anything else.
Yeah, thank you very much. This is a very important topic, and I want to take the opportunity of taking the mic to make also an information. There is a lot of work, a whole lot of work that has been done by WHO on patient-centered care. And in our last Congress, IHF Congress in Oslo this June, we had a full session that we partner with WHO. Everything is available on our web, and you can go there, and you have an overview with the major WHO regions for where we are with patient-centered care, and you have a very good frameworks on what patient-centered care. So you said that there is not a definition, but indeed now WHO has put out a clear definition, and the member states who are so representing the country have adopted the definition. So the issue is not about the definition, which is adopted by most of the country, is cascading from what is adopted at the level of government to the level of the facilities, those who are doing the work where there is a gap. And that's what we are working for in the International Hospital Federation.
Just to come back to you, I agree. And what I didn't say was there was no definition. What I said was when we talked to experts, there were many definitions. We've used the WHO definition in our report, so I agree with you. But I think the International Alliance for Patient Organizations, I think they summed it up quite well when they looked at this as far back away as 2003. They said, it's not worth the energy to work towards making sure everybody is using the same definition, because the essence of what those definitions mean are essentially the same. So as long as we understand what the essence of patient-centeredness is, that's the important thing. And the WHO has done a lot of good work. I think what we are trying to do, and would welcome anybody to get involved together with Monday Morning, is to develop a narrative where we can get all the stakeholders interested and build some enthusiasm and momentum to try and work together. And I think very often you have patient-centered care talked about in different organizations, a different forum, but maybe they're not connected in the way that they need to be.
So thank you for all the questions. So maybe I would like to ask the last question, okay? Very simple. Is there a cost attached to patient-centered care?
There is an investment cost related to parts of patient-centered care, but I think increasingly the evidence from Sweden, from the UK, from the US is that there is also cost savings to be made. So I think there is a very clear business case. The challenge is not developing a good business case, the challenge is developing a strategy to implement it.
So thanks a lot. So let's give a big hand to Stephen.